Hello, everyone. I'm London Breed, Mayor of the City and County of San Francisco, and I want to thank you all for joining us here today. I'm also joined by Dr. Grant Colfax, who's the Director of the Department of Public Health, as well as Mary Ellen Carroll, the Director of the Department of Emergency Management. Last week, we took a significant step to strengthen our preparedness for the novel coronavirus by declaring a local state of emergency right here in San Francisco. And as we said then, this declaration of emergency was about preparedness. It's so that we as a city could be ready. It's about making sure our city's prepared, our workers are prepared, our residents are prepared. And as we see more confirmed cases across the country, we know that we need to continue to do our part to protect our public health of all of our residents, particularly our most vulnerable residents. And while we still have no confirmed cases here in San Francisco at this time, we must be ready because we know it's coming. It's not a matter of if, it's really a matter of when. Last week, when we announced our local emergency, we committed to keeping the public informed of any actions that we're taking, every step of the way. And that's why we're here today. Our Director of the Department of Public Health and our Director of the Department of Emergency Management will describe in detail some of those efforts, but today we are announcing a few important steps. First, our Department of Public Health has begun a new process to test for the coronavirus locally instead of relying on shipping the test across the country to the Center for Disease Control, or the CDC. This will allow us to move faster and confirm any diagnosis more quickly. Second, we are reinforcing our efforts to prioritize protection of our most vulnerable residents who are more susceptible to getting very, very sick and sadly dying if they contract the disease. This includes seniors, whether they are living at home or in congregate settings. Third, we are expanding our deployment of city staff to help our emergency planning and response efforts. We are committing 50 more staff people to help in this situation. These are members of the city departments that are considered disaster service workers to help with these efforts. This means more people doing outreach in communities and doing the critical planning to prepare for what we know is coming. These are just a few steps that we are taking to further protect the public from any possible situation. We all know there will be more as this situation evolves, and we are committed to communicating to the public on a regular basis to make sure that we are all on the same page. Now, I know that there is a lot of fear out there. I know that there's a lot of confusion and a lot of questions. And it's important that we don't panic. It's important that we get the right information and that we work with the public to address this situation. We are focused on trying to make sure that we contain any situation that would occur, that we protect public health. That's first and foremost. So we don't want anyone to jump to any conclusions or jump to fear, because we know that fear will make it possible that less likely people will come forward when symptoms do occur. Our commitment to San Francisco and to our residents has always been the same. We will do everything we can to protect public health. Ultimately, that's our goal. And we will be fully transparent as any situation occurs. And we'll do our best to keep you informed about how we are doing that. And I want to really thank all the city workers, especially many of the city workers who are part of the Department of Public Health, for all the work that they have done on monitoring those people who are staying in their houses in case they've traveled or may have come in contact with anyone. I want to thank the Board of Supervisors for supporting the declaration of emergency. And I want to really express that, these are very, very challenging times that we know, but we will get through this. We will get through this together. San Francisco has some of the best public health experts anywhere in the country. We have some of the best situations and equipment and things to handle situations of this nature. And so our goal, again, is to keep the public keep the public safe and keep everyone informed about what they need to do in order to ensure that. And so with that, I want to take this opportunity to ask President Norman Yee of the Board of Supervisors to come and say a few words before we go into the details around public health and others that we need to provide you with.
Thank you, Mayor Breed. I just want to reiterate that the city must and will do as much as we can and play our part in the prevention, containment, if we need to, as much as possible. As you already heard, Mayor Breed laid out a plan for this particular step, activating more people, more resources to deal with this issue. Now, I've been urging her to make sure that the public understands this and constantly give clear indications of what we're doing on a regular basis. And it shouldn't be something where it should be a regular in the sense that we should pick a day or every other day where we just come out and say, this is what's going on in San Francisco. It's really important for people, our communities, to understand what's going on and have clear answers. I'm glad that we're focusing on the most vulnerable. That's something that the community that I've been to in terms of discussing the virus has been saying we have to be able to prevent it from there because they are the most vulnerable, the seniors and the younger kids. And the last thing I'm going to say is that the city is going to take leadership. It's going to provide leadership in any prevention measures that we can do. But this is not just a city government issue. It's a whole community's issue. So it's not only what we can do in city government, but also the community themselves in terms of prevention, understanding what they can do to prepare for things, and take cautious about their own environment. Thank you very much.
Thank you, President Yee. And Dr. Colfax will provide us with the details of the specifics of what the Department of Public Health are doing to address this issue, along with a number of recommendations that we could put forth that would keep you safe. Dr. Colfax.
Thank you, Mayor Breed. Hello, I'm Dr. Grant Colfax, San Francisco Director of Health. Last Monday, Mayor Breed announced a local emergency to boost our preparedness for the arrival of novel coronavirus to our city. It has been a busy week with many developments in the Bay Area and on the West Coast that affirm our decision to get more prepared. The situation is changing rapidly. This is the core work of public health. The novel coronavirus, also known as COVID-19, shows us exactly why we are here. Right now, there is nothing more important to the health department. We are on the frontier of a global outbreak and have an opportunity to prepare and protect our community. Since our declaration, we have been joined by Alameda and Orange counties in reaching for the tools of a local emergency declaration to strengthen our preparedness and response. As of today, the new coronavirus has sickened more than 88,000 people worldwide and tragically has caused more than 3,000 deaths. The numbers are changing rapidly. California has about 40 cases of coronavirus, a combination of people from repatriation flights and those identified by local health departments. These numbers will increase. For San Francisco, it is not a matter of if, but when. We expect to have confirmed cases of the new coronavirus in San Francisco and are preparing for community spread of the virus. The health department is prioritizing protecting populations that are most vulnerable to becoming sick or dying if they get the virus. This includes the elderly and people with chronic diseases such as diabetes and kidney disease. Today, I am proud to announce that our Department of Health lab began testing for COVID-19 novel coronavirus this morning. This is of benefit to our community because it will speed testing and results. Our lab will conduct tests 7 days a week with a 1 to 2 day turnaround time. Previously, all the testing that was done on San Francisco residents had to be sent to the Centers for Disease Control laboratory in Atlanta with a 3 to 7 day turnaround time. But now we will get answers faster. I want to be very clear on the process. The testing process itself will not change. San Francisco healthcare providers who have patients with suspected coronavirus will still consult the health department's communicable disease team that will contact the Centers for Disease Control to determine if they meet criteria for testing. Our local lab will then conduct tests based on the Centers for Disease Control criteria. It is very important for the public and the press to understand that there is no on-demand testing at this time. The test kits from the Centers for Disease Control are limited, and testing will be done only after consultation between local health officials and the Centers for Disease Control. It is also important to understand that because we are testing more and more people will get tested more quickly, we are likely to diagnose a case very soon. As the situation continues to expand, let me remind you that every single person in San Francisco should play their part. Be a good public health citizen. Wash your hands. Cover your cough and sneeze. Stay home if you are sick. Get a flu shot, which while it does not prevent coronavirus, it prevents symptoms similar to coronavirus. These actions will help slow the spread of the disease and protect yourself and others from harm. And also, very importantly, do not go to work if you are sick. For those San Franciscans who are most vulnerable to becoming sick or dying if they get COVID-19 novel coronavirus, the city is taking steps to prioritize and protect them. Here are some examples. Our public health system is reaching out to our patients with chronic diseases, complex medical needs, to see them now and to ensure that they have their medical needs met for the next 90 days, including medications. These strategies will help people with high needs and high risk avoid the medical system except when they have the most urgent needs. It will keep them healthier and free up the system to care for an influx of patients should that occur. We have also identified experts in infectious disease, kidney disease, and other specialties who will be working closely with long-term care facilities and dialysis centers to ensure that they have educated staff and residents about coronavirus, and that they implement prevention measures, and that they can rapidly identify and isolate patients with the disease. We are doing outreach to congregate living settings to educate residents about the virus and how they can protect themselves. The Department of Homelessness and Supportive Housing is part of the city's Emergency Operations Center. They have communicated with all their nonprofit partners and outreach teams and have provided them with information for clients, staff, and community members. This week, we will begin outreach to shelters and navigation center staff and participants. And we will continue to outreach to long-term care facilities, boarding cares, senior citizens, dialysis centers, and other organizations that serve priority populations to provide information for program management and residents. The city will work best if we all do our own part to prepare. City resources can then support the most vulnerable and those in need of most help. That is the best way to support the health and safety of all San Franciscans, our entire community. Thank you.
Thank you, Dr. Colfax. And now we'll have Mary Ellen Carroll, the Department of Emergency Management.
Thank you. I'm Mary Ellen Carroll. I'm the Director of the Department of Emergency Management. San Francisco plans for, responds to, and recovers from emergencies as a community. Since the outset of COVID-19, the City and County of San Francisco has stood shoulder to shoulder with the Department of Public Health and our community partners to ensure that people we serve can stay informed and stay healthy. Together, we've hosted community roundtables, demonstrated our support for neighborhood businesses, and denounced xenophobia and discrimination. Our actions are all about preparedness in the Emergency Operations Center. The global, national, and regional picture is changing rapidly, and so we are taking steps to protect San Franciscans from harm. Since our declaration of the local emergency, the emergency operations has accelerated our advanced planning and developed alternate housing options for people who may need to be medically supported because of COVID-19. We have streamlined our protocols for resource requests. We have activated dozens of disaster preparedness coordinators and disaster service workers. We have developed and disseminated COVID-19 health and preparedness information in English, Chinese, Spanish, and Filipino, and as we speak, we're developing many other languages. In addition to these efforts, outreach staff have participated in more than 30 outreach events throughout San Francisco since late January, reaching tens of thousands of San Franciscans. These actions are just some of the aggressive steps to bolster the preparedness for the arrival of COVID-19 to the community. Beginning this week, San Franciscans will activate, as the mayor mentioned, more than 50 additional disaster service workers. And additional personnel include, but are not limited to, planners, analysts, community engagement specialists, public information officers, bilingual employees, administrative staff, and those who have received training in emergency response and the incident command system. We are also activating volunteer organizations, including but not limited to the San Francisco Fire Department's neighborhood emergency response teams, the San Francisco Police Department's auxiliary law enforcement emergency response teams, that's NERT and ALERT, to increase the scope of our outreach and our education efforts. We believe this further activation of disaster service workers and volunteer organization builds on our aggressive strategy to bolster our preparedness for this disease. Finally, we want to talk about what the community can do. A well-informed and educated community is essential to preventing the spread of COVID-19 virus as well as any virus. Dr. Colfax and the dedicated professionals within the Department of Public Health have already shared tips on how to stay healthy and how to prevent the spread of illness. Also how to help others who may be ill. So there are other things that we can do and individuals can do as a community to prepare. People should start to plan for the potential of possible disruptions caused by COVID-19. Some of the actions that we are recommending are to make sure you have a supply of all essential medications for your family, to make a child care plan for you or if your child care provider is sick. Make an arrangement and think about how your family will manage a school or a business outage. And finally, make a plan for how you can care for a sick family member without getting sick yourself. Finally, we have a number of ways to stay connected to this rapidly evolving topic. The main website for information for the city is going to be www.sfdph.org. That's the public health website, and that is being maintained on a daily, if not hourly basis. In addition, you can call 311 in San Francisco for information that you don't feel like you can find on the website, or for people that don't have access to that. 311 is available to provide more information. Thank you.
All right, we're happy to open it up to any questions you might have.
This weekend there were many videos of people just storming Costco and Safeway. I went today to several Safeways and Walgreens, and they're still buying, like you see, empty shelves of hand sanitizer, Clorox. Have any anything to say to the people that are freaking out and just buying control?
Well, I know that, again, there is some level of fear, sadly, that's out there over the uncertainty around what's happening with this virus. And I think that's why we are here to communicate to the public exactly the facts of what's happening in hopes that they don't freak out. We don't want the public to freak out over this because the fact is that creates chaos. We don't want chaos to happen. There is no need for chaos. There is need for us to communicate clearly what people should or shouldn't do as it relates to the virus or preparedness or anything of that nature. And sadly, there will be some levels of fear, but that's what we're here to do. We're here to make sure that we provide as much information as possible, that we support public health by the decisions that we're making every single day. I did not take a declaration of emergency lightly, but it was really all about preparedness so that we are ready, so that we do contain it in case there is a case here in San Francisco. So this is why we think it's important that we provide regular updates to help address the fears and the concerns, and we hope that this does that, and we'll continue to do it as much as we possibly can.
I don't know if this is a better question for Dr. Colfax or for you, but wondering if there are any plans currently in the city to either change or alter areas where people do congregate. In other words, I'm looking at SFMTA in the schools in particular, which are areas where you get a large number of people coming together and then dispersing. Are there any plans to either change the way SFMTA operates, cleans their vehicles, or is there any plan for San Francisco schools that you're aware of to alter how children go to and from school or any kind of cleaning in school?
So part of what we've done in this declaration is worked with a number of nonprofit agencies to do a lot more outreach around congregate living, as we had discussed. There are a lot of people who live in SROs. There are a lot of seniors who live in SROs, and so doing outreach to those communities and working with the nonprofit agencies around education and ways in which we can work with them and provide the support and resources to those communities is important, but also reaching out to our various departments and working with our departments to make sure that we are all working with the staff members, preparing everyone, making recommendations, the cleanliness that we have to have in order to address those issues are important, but ultimately I think it's important that we do exactly what the Department of Public Health has suggested, and that is some of the things around, covering our coughs or our sneeze, staying home if you're sick. I mean, because we know that to contract this disease, it involves some level of it getting out there through other means. And so I think it's important to stick to the recommendations that are being made, and we'll continue to do our very best.
Would that even be either feasible or advisable to try to do anything to, I know that some school districts, for example, are doing deep cleans for their schools. I don't know if that would be directed by your department for the schools to do that or for SFMTA to do that.
So just to, so our infectious disease experts and our environmental health team are reviewing these protocols with the entities that you're talking about to ensure that the steps that are being taken are commensurate with the latest recommendations on how to best clean from the CDC. At this time, there's no recommendation to close or mitigate services of the entities you're talking about. We really need to follow the best science and evidence here and recommendations, and there's no recommendation at that time for what you're asking. Thank you.
Another follow-up question for you, Dr. Colfax. So using those wipes, those Clorox wipes, does that actually help?
Yeah, so the standard cleaning solutions, and we have a list of that information on our website at sftph.org. Those standard cleaning solutions will help prevent transmission of the coronavirus. Things like the hand sanitizer, and again, washing your hands just with regular soap. Cheap soap is fine. So just taking those standard precautions is very important at this point.
So you also talked about about community spread, what's the timeline that you might have in mind based on what we're seeing across the state and what we could potentially see here in the Bay Area with the spread?
So there have been cases of what appears to be a community spread in the Bay Area. As I said, we are starting testing locally today, so I anticipate that we will detect cases relatively soon. I can't speculate on a specific timeline beyond that.
What if anything is the health department doing with homeless folks?
Yeah. So with regard to that, we are working very closely with the Department of Emergency Management and the Department of Homelessness and Supportive Housing to ensure just what we were talking about, that people who have high medical needs who are at particular risk are being cared for, getting the supply of medications. We're educating staff and the actual people who are experiencing homelessness to ensure that they're taking the best steps. And Mary and Carroll of the Department of Emergency Management talk a little bit more about the care and shelter efforts that we're undertaking now.
Given the constraints on testing locally that you described, could you talk in a little bit more detail how or who is being prioritized? Is it the seriously ill or people presenting symptoms there?
So in addition to the CDC criteria around people who come from high-risk areas or people who have symptoms who have come into direct contact with people from high-risk areas, the CDC recommendations are to test people who are seriously ill with symptoms consistent with the coronavirus, but have no other known disease or pathogen that is being that they have. So if you are in a hospital, for instance, right now, and have symptoms consistent with coronavirus infection, other tests for other viruses have not yielded anything, you would be potentially a candidate for testing.
What kind of strain does this place on the public health department in terms of staffing, funding, and personal protective equipment?
So in terms of, the declaration of emergency was just a huge step forward. I'd like to thank the mayor again for that, because it really allowed us to mobilize our resources and staffing. We have a large department. People are being, anything that's non-essential right now, people are being called to duty to focus on this work. And we have a very strong bench of infectious disease experts, environmental health experts, community education people. So we're really focusing not only on the direct medical care from the primary care clinics to the hospitals and engaging those vulnerable communities, but we're really working to push out consistent fact-based recommendations so the public can do their part and we can do our part. Well, so with regard to the funding, again, the emergency declaration allows us to be eligible for potential federal funding if and when that does become available. So that was a big step, because our systems are now in place to recoup expenses as much as possible with regard to that. With regard to personal protective equipment, we are prioritizing that. As you know, there is no recommendation for the general public to wear masks. We need to save masks for people who get sick and people are at highest risk for transmission. And we're working with our environmental health teams and infectious disease experts to ensure that staff are safe. And that's a really key part. When we see responses to these things, one of the key things we need to ensure of and prioritize is that staff have the protection that they need to be able to serve people better. Thank you.
If the case spreads in San Francisco, will shut down the local business and shut down the school will be one of the solutions to stop the spread. And also, if people buying masks and all the sanitizer supplies now, will this influence the doctors and nurses to use them? So I want any.
So there are no plans at this time to shut down the systems that you were just discussing, but obviously this is a situation that can change, but I just want to be really clear about that. I think as much as we can model our good health behavior with regard to hand washing, hand sanitizer is good. If you don't have hand sanitizer, again, cheap soap is just as good, is just as effective. So some of the simple solutions, while we're looking for complexity here, some of the basic simple solutions for good public health is the best way right now to prevent yourself, your family, and to protect the public from acquiring this virus.
Any plans to contract out with other cities for more negative pressure beds if necessary? We said at the last press conference we have about 100 here in San Francisco, 50 of those are SFGH. Any plans for further contracts?
So we are. So one of the key things is we are working across medical systems within the city. We have a robust medical system with Sutter Health, Dignity Health, Kaiser, and others. So we are looking at a cohesive response and harnessing our collective resources to ensure that we are as prepared as possible. We are also on regular calls with all the surrounding counties and ensuring that our health care systems are aligned, and that in the case that there need to be resources available for one county or another, that we're breaking down those barriers to best protect the health of San Franciscans as well as others in this community. Thank you.
The testing that you're doing, are you using those test kits from the CDC, or are you doing your own kits?
So these test kits are from the CDC.
How much are they?
I have our director of communicable disease here. I don't have an actual a price for you at this point, but we can get that to you very easily.
Do you have enough money to buy as many as you want?
We will get as many test kits as we can get and as we need at this time. Resources with regard to the test kits are not an issue at this time.
So talking about the test kits, you said that the testing is limited. So what does the testing actually involve when you're talking about a test kit? How do you guys go about this? Can you explain that?
So the actual, I'm sorry. So basically, what would happen is if somebody is eligible for testing, so we would go through the standard CDC protocol of providing the testing. There's a test that's done initially, and then there's a second test that's done to confirm a diagnosis. So it's a two-step process. So just to emphasize that the total of 250 test kits that we would get would really allow us to test 125 people, again, who are at high risk for the disease at this time.
My question was more.
Initially?
I'm sorry?
250.
That's initially. We are optimistic. We anticipate getting more of these test kits later this week. We don't have a specific time yet that I can share with you.
Will that be a free cost, or would like the insurance pay for that, for the people?
So this is through the public health department, so we will absorb the cost for the people who are testing for high risk. This is a public health intervention, as well as important to test the individuals themselves. So the cost will not be a limiting factor at the individual level for the person who is at high risk. But again, I want to emphasize that we have to really prioritize who gets tested, that there's not on-demand testing at this time. And they're very clear protocol based on science and the evidence that the CDC has in terms of who would get tested.
And to clarify, on-demand testing means, because I just tweeted it out, there was some question about that. On-demand question means I can't come in and say, I feel sick, test me for COVID.
That is correct. That is correct. People, if people stay sick, one, they should stay home from work, and they should make sure that they're doing all the proper public health steps that we talked about. Consult with their physician or medical professional, and then that information will help determine whether and how the health department determines whether they're eligible for testing based on the evidence, the science, CDC criteria.
Where will treatment and testing be centered in San Francisco?
I'm sorry?
Like, is there a location that where you?
So we will be doing so people can go through their normal clinic. We will be testing at the public health laboratory, but people don't have to go there to be tested.
All right, so we have a question. So if the people feel they are sick, so they want to just do the test, there any cost for them, or is only no cost for high-risk people?
So let me be very clear. In order to be tested, people have to meet very specific CDC criteria. And if they do meet those criteria and we have the test, they will be tested. Cost will not be an issue there. But people need to meet specific criteria. There is not testing on demand at this time. And people should talk about their symptoms and their concerns with their primary provider, healthcare provider, as a first key step going forward. Thank you.